Hi everyone, and welcome to BioGenie. It's a podcast where science meets everyday life. My name is Arya Parekh, and I'm an IBDP biology student who's enthusiastic and loves to explore how science connects to everyday life. My guest today is rheumatologist Dr. Jain. From understanding why our joints ache to decoding the autoimmune system, he's here to simplify the science behind all of it. So let's get started. Doctor, thank you so much for coming today.
Thank you, Arya, for inviting me. It is a pleasure. It's always a pleasure. Thank you.
So let's start with today's
So, how
podcast.
are you?
I am good. How are you doing today?
I'm good. So let's start.
Let's get started. So, question one, what made you fall in love with the immune system? Was it curiosity or chaos that drew you in?
So, actually, during my residing with the rheumatology patients, that how can we control the immune system, regulate it and not put the patient under risk when we are trying to regulate the immune system. So initially it was a elegant curiosity, but since
Yeah,
now I have entered it, it is the chaos, the organized chaos that keeps me in it actually, keeps me busy in it. So
yeah,
it
that's
is good
interesting.
actually.
So, our immune system is like an army, but sometimes it turns against us. So, why does that happen?
So actually, the science behind that is it is a break in self tolerance. So many of our body cells they have receptors on their surfaces. So our immune surveillance cells they keep on checking those receptors and see to it that these are our receptors. So this happens millions or trillions of times in the body during circulation in our thymus and spleen. So, whenever there is a break in self tolerance, which is often a trigger by an environment or a stress or an infection, things go haywire. So, that is why when our immune system starts attacking our own cells, so a common terminology uses molecular mimicry. So, suppose an infection has some receptor which seems to be similar, like to one of our receptor over our cells or an antigen basically. So there's a molecular mimicry. So instead of attacking that antigen, along with that antigen, our body kills our own self antigen, which seems
Okay.
similar to the bacteria or the viral antigen or the receptor. So there the problem starts actually.
Okay, I think that's something interesting that people should know more about. So in biology, we discuss antigen antibody specificity. So how do biological drugs take advantage of this concept to target the autoimmune disease?
So if we look at the history of treatment in rheumatology, so it has we have been progressing at a good rate. So initially, what used to happen is that we have been using steroids, glucocorticoids, that is. So what actually it does is it resets the complete immune system. So but with this, there are increased chances of infections and the toxicity of glucocorticoids can take place and we cannot give it for a longer duration. But with this monoclonal antibodies, we are targeting a specific cytokine. So cytokine is anything which increases the inflammation in the body. So we are targeting the specific cytokines rather than completely targeting the whole immune system with glucocorticoids. So these biological antibodies they target the cells which are making long lasting antibodies in our body. So these antibodies, what they do is they target our self antigens. So with with this monoclonal antibodies, we are targeting this long-lasting B cells actually. So if I want to simplify this, so we have B cells which can produce antibodies. So these antibodies they actually prevent us against infections. Okay, but
Oh,
if these antibodies are working against our own antigens, then they are going to damage our own antibody. Sorry, our own immune system is acting against our self antigens. So it is trying to damage the surrounding tissues. So what we are doing is with this monoclonal antibodies, we are targeting this B cells, auto-reacting B cells, which are targeting our surrounding tissues. So with the help of this, we are actually moving towards targeted therapies actually.
Okay, all right. That's something new. So, when the syllabus talks about immune response regulation, it sounds simple, but in real life, how hard is it to regulate immunity through treatments?
So actually, speaking of this, it is a double-edged sword actually. So if we try to suppress the immune system, patient has risk of infections, and if we do not suppress it adequately, then patient has a chance of progressive inflammation, continuing inflammation.
Yeah.
So what we do is we initially use glucocorticoids to suppress the inflammation at a faster rate. And then we use some glucocorticoid sparing treatment, like apart from glucocorticoids, which will regulate the immune system but will not cause side effects of the glucocorticoids. And along with this, we vaccinate our patients
Okay.
so that they are not prone to infections. So this is how we try to, balance it. So it is not
Okay.
like a easy switch on, switch off button.
Yeah.
Suppose if we want to switch it off, we cannot switch it off. Dynamic thing.
Okay. Okay. So, autoimmune diseases are often linked to genetics and environment. In your experience, which one plays a bigger role, our DNA or our lifestyle?
So this can be explained by a simple statement that genetics is a loaded gun, and often environment is the thing which pulls the trigger.
Okay.
So suppose a patient who is who has if you have arthritis, so in which patients have peripheral arthritis and some inflammatory back pain. So this is to do with genetics. So often patients have HLA-B27 positivity. But there are patients who have this HLA-B27 in their gene, genetic makeup, but it is often triggered because of smoking or a bad diet, which can lead to a leaky gut, so gut inflammation. So these environmental triggers like smoking, infections, chronic stress, bad diet can lead to a trigger and which can bring out the disease in the first.
Okay. So I think that's something informative that all of our viewers should know about. So, as students, we're told that inflammation is a defense mechanism, but in rheumatology, it's the main villain. So, what flips that switch?
So inflammation is actually good when it is acute and self-limiting, especially during infection. Suppose if you are suffering from sinusitis, a bacterial sinusitis, bacterial pneumonia, or any other sense of infection. So our body actually tries to react to it. So whenever our body kills pathogens, there are cytokines released and they usually cause fever. So with increase in temperature, the bacilli, the virus, they actually die. But if this inflammation is not controlled, so it can lead to further damage. It can be life threatening also, and it can also lead to an autoimmune disease if there's a genetic predisposability.
Yeah.
So it is not the inflammation that is the villain. Actually, it is the chronicity and the uncontrolled process which occurs because of the genetic predisposition and the environmental trigger, actually. So it is
Okay.
a hero because it prevents us from infections, but it is a villain if it is a chronic process.
All right. Okay. So, can diet, stress, or lack of sleep actually trigger or worsen the autoimmune system?
Yes, actually. So there are actually some truths and some myths about it. So I will speak about the myths actually. So I often see patients in my clinical practice saying that, सर खट्टा खाने से मेरा आर्थराइटिस बढ़ता है. मैंने दूध दही खाना बंद कर दिया है. I have also stopped eating pulses. So actually none of this makes sense and it doesn't predispose you to arthritis or none of these is causing increased symptoms or increased joint pain actually.
Okay. So, those are
But
the
diet, stress, yes, these are the myths actually.
okay.
So diet, stress does play a role. So this is a emerging concept known as gut-brain immune axis. So gut is linked to your brain because gut also has a nervous system which is known as an enteric nervous system. So whenever your gut has a problem, suppose inside the gut we have a lot of good bacteria. So if the ratio of that good bacteria is disturbed and the amount of bad bacteria increases, there is gut dysbiosis, right? So there's an imbalance between the good bacteria and the bad bacteria. So it is known as dysbiosis. So permeable to this bacteria and toxins. And so that they enter a blood circulation, they cause inflammation, the inflammation goes to the brain, and it also then affects the immune system. And majority of our immune cells are actually residing in the gut. So these cells get activated and they, move into the blood and then move into different tissues and damage.
Yeah, okay.
So anything which affects your gut
Hmm.
can, affect your immune system and the brain. So you have to ensure a good diet. And recently, I also read a book known as, the book called The Glucose Revolution. So
Okay.
it helps you improve your diet, reduce your glucose spikes. So excess of sweet, excess calories, how you can control it and how it helps you regulate your glucose spikes and control your inflammations.
All right. Okay. So, how does vaccination, which is another core topic in my school, how does it affect people with autoimmune conditions or those who use immunosuppressants?
Okay, so to understand this, any patient having a rheumatological illness is on immunosuppressants, right? So we are reducing the amount of immunity. Actually, in simpler terms, we are trying to regulate it. So during that time, patient may be predisposed to infections, right? But if we want to vaccinate him, we give him inactivated vaccines. Actually, there are live vaccines and inactivated vaccines. So inactivated vaccines, with that, there is no chance of reactivation of the virus or the pathogen which we are using it. So if we use a live vaccine, it can, it is, though it is attenuated, it may predispose the patient to infection. So in rheumatology practice, we use inactivated vaccines actually,
All right. Okay.
to prevent infections actually.
Oh. So, what recent research or breakthrough in immunology excites you the most, and what's something that could inspire future scientists in that field?
So actually, there is a lot of research going in rheumatology, especially on CAR T cells. So majority of the things we have been borrowing from our from our sister branches. The most important is oncology. So
Yeah.
from oncology, we have been borrowing a treatment which is known as CAR T cell, which is in that actually we are genetically engineering T cells outside the body to target the B cells, which actually make auto antibodies in our immune system, and they target our tissues. So with this genetically engineered CAR T cells, we are trying to kill the B cells which have gone rogue and which are deep inside the tissues or bone marrow, which which our body is not able to control them. And these monoclonal antibodies are actually failing to kill them. So this is something new in rheumatology actually.
That's very fascinating, actually.
So
So,
every patient actually here, for every patient, the treatment varies actually. This is where
okay.
precision medicine comes in, where every patient has a different approach, different clinical presentation, and different line of treatment.
Okay.
So here precision and medicine and endotyping comes into play. So endotyping is also something new, where based on patient cytokine profile, genetic profile, we are targeting them with these monoclonal antibodies, because one monoclonal antibody might work for one patient, but it might not work for the other patient. So these two are the new things which are coming up with rheumatology.
Okay. So, the treatments carried out are specific to the patient's level of illness or.
Yes.
Okay.
Depends. So suppose treatment A will work for patient number one, but it will not work for patient number two because of the different genetic makeup, different profile of inflammation. and different environmental triggers. So this is something.
All right. And lastly, if an IBDP student like me wanted to pursue immunology or rheumatology, what skills or mindset should they have, and what are some tips that you would give us to focus in that line?
So our guide always used to tell us that think. If two things do not match or correlate, you should always think rather than ठीक है चलो हो सकता है. Always dig deep and have a systematic approach. Like you have to look at all the organs at together because any disease can affect any organ in rheumatology. So you cannot have a horse vision because you have to, look at the sides, front, back, everywhere. And second is that you should be comfortable with ambiguity because rheumatology is a branch where there is so much chaos and still you will have to move forward and at this situation also many of our experienced rheumatologists often conveys that they are also still learning rheumatology. So medicine actually is a science of uncertainty and an art of probability.
Yeah.
So yeah.
Okay. So that's it for today, Doctor. Thank you so much for coming on the podcast today. It was very interesting, and I'm pretty sure I found this very helpful. I learned about a new field today. So thank you for coming.
Thank you. Thank you so
And
much.
yeah, and
Have
to
a good
our
day.
viewers, if you're interested in biology, make sure to like and subscribe to this channel. We post things that are connected to everyday life every day. Thank you.